Today we will be discussing about the treatment options for azoospermia. You must be wondering what is azoospermia. Azoospermia means zero sperm count. If somebody does a semen analysis test, and if his semen analysis report says sperm count is 0, then we call it as azoospermia. So now wait, the moment you see a report with 0 sperm count or azoospermia, it is not the end of the road for you. There are so many treatment options. So let us understand what is azoospermia. So azoospermia means, as I said, it's 0 sperm count, and there are two types of azoospermia. One is obstructive azoospermia and second one is non-obstructive azoospermia. Obstructive azoospermia means there is production inside the testicles, but for some reason this is not coming out. This is called obstructive azoospermia. So, and second type of azoospermia is non-obstructive azoospermia. We call it as NOA. NOA means non-obstructive azoospermia. So now if you if you want to discuss about the reasons for both, one, obstructive azoospermia, the commonest cause is infection, and because of the infection there is blockage in the tube. Second commonest cause for obstructive azoospermia is previous surgery. Sometimes when any inguinal surgery was done, or sometimes hernia repair surgery was done, or because of some accidents or some major surgeries, there might be blockage in the sperm tube. This is one cause. So now in that case it's very easy. We can actually we can find out whether there is obstruction or not by doing a procedure called TISA. That will tell us the production is good or not. Then we can actually try to repair the problem or reconstruct the problem. So now now treatment for obstructive azoospermia is easy. One or the other we have some treatment options. But the main issue is with non-obstructive azoospermia. Non-obstructive azoospermia means the production inside the testis is not good or very little. Only in some areas of the testis there is production. Now what has to be done? So now in non-obstructive azoospermia, the major cause is either genetic cause or childhood infections or some kind of strong medications which can cause non-obstructive azoospermia, like steroid intake, long-term steroid intake, long-term testosterone injections, and sometimes environmental effects, long-time pesticide exposure, long-time radiation exposure, all these things, and sometimes childhood mumps or any infection to the testis where the testicular tissue has damaged because of the infection. All these things comes under non-obstructive azoospermia. In non-obstructive azoospermia, generally we do procedures like TISA, micro-TISA. Once we get sperm in these procedures, we can actually freeze it or we can use it for IVF procedure. So now based on the tests what we do, generally we do some hormonal tests and we do a scrotal Doppler scan, we can understand what exactly is happening in the testis, whether this is an obstructive azoospermia or non-obstructive azoospermia. So viewers, whenever you see a report of azoospermia, don't get tensed up. Even though there is azoospermia, still there is treatment. There are so many treatment options. So let us evaluate and then we will come to a decision.